Yo, what's up, guys? Welcome back to the nursing channel. It's your favorite nurse, Nurse Sam. And so, man, it's been a while since I made a video, so I'm glad to be back. And so, let's talk about nursing case management. Before I start talking about nursing case management, I want to clear the air because a lot of people have been asking me, Sam, are you single? And the answer to that is yes, I am single. However, actually, if you are single, feel free to slide in my DM and we can talk and get to know each other. And I'm just kidding. Anyways, in all honesty, yes, I am single to answer your question. However, I did get into a divorce earlier this year, so I still have those fresh wounds on me, and I'm still trying to heal. So I'm not looking to get back into the dating scene. So I'm not in the market just yet. I'm giving myself some time to heal, and eventually in the future I will definitely get back in the dating scene, and I will keep you guys posted if you guys are curious to know, okay? But let's stay on topic. So the question is, why did I get into nursing case management and why did I leave bedside nursing? All right, so there's a story behind this. And so it all started when I was a new graduate nurse, and the first floor I started working on was med surg. And med surg, you handle 5 patients, and it's 5 patients to 1 nurse. And so I remember just working, and as a new grad nurse, all the older nurses and all the female nurses usually would always call me and be like, Sam, help me turn this patient. You have strong muscles. I know you can turn this patient by yourself. And me being a naive nurse and being generous and nice, I would like, okay, yeah, I'll turn this patient for you. And oftentimes I was doing it by myself. And after doing it so many times, I noticed that my lower back started to give out and it would hurt. And I was like, man, this is not good. It's like I'm barely in my 20s and my lower back's already hurting. Usually when your lower back starts to hurt, it's when you're like much older, you're like in your 60s, in your 70s. And so I found it really odd that my lower back was already hurting at such a young age. And I also noticed that a lot of like the older floor nurses had back braces, and I was like, man, I don't want to be like that. I don't want to get to that point where I need a back brace to walk. And so I started to think about these things, and so I started to like think about like, are there other areas of nursing that I can work in? Because it doesn't seem like being a floor nurse is a career I can be in a long term, because if I'm already getting back pains, I can't imagine what it's going to be like when I'm 40 or 50 or 60 as a floor nurse. Some of these older nurses, or veteran nurses on the floor, are barely walking, super slow with these back braces, and they're hunched back, and they're turning patients by themselves, patients that are just as old as them. And it's kind of sad, because I think floor nursing is primarily for younger nurses. Not saying that the older nurses can't do it, but I think like from a health standpoint, I think it's primarily for the younger nurses. But anyways, not to discourage the older nurses who are watching this video. If you love floor nursing, stick to it. But for me, I wanted a career where I can last long as a nurse. Even if I was white-haired and old, I can still be a nurse case manager, and I know it wouldn't be a problem doing it. I wouldn't have a problem doing it. And so that's primarily the reason why I got into nursing case management. And I also asked the older floor nurses, like, hey, why did you stay in this floor for so long? Because they were on the floor for like 30 years and they never decided to branch out to a different department. And they would just tell me, oh, I just got comfortable here and I've been doing it for such a long time, I just decided to stay. And so I was like, and for me, like, I like to think outside the box and give myself an opportunity to discover different areas of nursing. And so that's what I decided to do, and I found nursing case management. And when I found nursing case management, it was like a pot of buried gold that I was looking for. And when I found out I don't have to wipe butts, I don't have to transfer patients onto the bedside commode, I don't have to give medications, I don't have to hang IV bags, I don't have to do any patient care, I don't have to give updates to upset family members on the clinical status of their patients. Like when I found this out, I was like, this is amazing. This is like awesome. Anyways, not saying that bedside nursing is bad. Those bedside nurses who are great at what they do, kudos to them, because we need you floor nurses, because without you guys, this world would not be a better place. You guys make this world a better place with your great nursing skills and your great bedside skills. So I want to thank you guys actually. But anyways, for me personally, I was a good floor nurse, but I didn't really enjoy it as much. I felt like I was just tasking constantly. I felt like I was answering a lot of call-outs for just like simple stuff, like a patient wanted a glass of water or a peanut butter and jelly sandwich or some Jello, and it's just like, or a family member wanted to talk to me about something that, you know, we had already mentioned to them, or, you know, it's a lot of drama, if I can say, on the nursing floor. And so I was able to kind of bypass that. Anyways, I found nursing case management and it was amazing. Nursing case management is not a walk in the park either. It has its stressful days, but it's a different type of stress. It's a type of stress where you know, you're probably dealing with upset physicians or upset patients that want to go home already, or communicating with vendors and trying to get them to deliver the equipment to the bedside as quickly as possible. That's the type of stress you're dealing with. But the type of stress you deal with as a floor nurse is different, and part of that stressor is that, you know, you have to be on top of your stuff as a floor nurse, because if you make a mistake, you can potentially kill a patient, you know, if you give them too much of a medication or too little. So as a floor nurse, it's a different type of stress. As a nurse case manager, it's a different type of stress, but I feel that the stress as a nurse case manager is a lot more manageable. So anyways, that is primarily why I got into nursing case management. And if you're interested in becoming a nurse case manager, give it a shot, apply for a position, don't be afraid. And thank you for watching this video. If you like this video, give it a thumbs up. And if you're interested in nursing case management, I have a lot more videos on different topics, so feel free to watch those. And don't forget to subscribe to this channel. And to all my subscribers, a big thank you from the bottom of my heart. Thank you for supporting this channel. And if there's a specific topic that you want me to discuss, feel free to put a comment below and let me know. Anyways, I love you guys. Take care. This is your boy, Nurse Sam.